Hello, I'm reviewing the case study for AFib. The first question is, what risk factors does a patient present with, and what additional questions are necessary? First, the patient has a past medical history of hypertension, congestive heart failure, and he reports that he's not compliant with his medication due to financial issues. You can ask the patient about chest pains. Does he have any leg swelling, any headaches? Ask the patient if anything specific brings on this occurrence, like stress, exercising, if he eats a heavy meal. You get the patient's medication list, even though he's not non-compliant, just so you could go through the list to see what adjustments can be made that's, make it easier for the patient so he can take the medication. You could kind of combine stuff if you can, just so he could just get one pill instead of two. Ask about caffeine and alcohol intake, because that could be a lot of cause of problems that people don't realize that they're causing damage by a large amount of alcohol and caffeine. And then you could discuss the patient's financial issues and see how you can help, because they, like I said before, you could change the medication to something that's less expensive, or you could offer some kind of copay help. It's a lot of companies out here that will help the patient to pay for their medication. The next question is, how will you evaluate and manage his risk for embolism? Well, you just evaluate and implement lifestyle changes, as this will support the anticoagulant therapy and the overall health. Then you could evaluate and implement a healthy diet, giving the patient resources and, just to either give him a list of foods and recipes and things that he could use, to lose weight, and then exercises that he can do to help for him to lose weight and to stay healthy. And then you can start and manage the anticoagulant therapy, which is called, people usually call blood thinners, as this will reduce strokes by 60%. You could either use direct oral anticoagulants, which does not require INR monitoring, or you could use warfarin that does require INR monitoring. The next question is, with the known clot, what are the implications for evaluation and treatment once the clot has formed? What you need to do is focus on the location and the size of the clot, as they may travel and cause more damage, which may cause like blood clots, which can, cause a pulmonary embolism, which isn't good. You could treat with anticoagulants to prevent growth and travel of new clots. And you need to determine if clot blockage is an emergency, which can be deadly to the person if it's blocked somewhere over time. So you could utilize ultrasound to identify where the clot is, whether it's a deep clot or a superficial clot, which is very important to identify early. And the primary goal is to prevent the clot from getting larger or moving. And once you treat the clot, eventually it will dissolve on its own. So with AFib is very treatable, but you have to catch it early or when it first happened. A lot of people, most of the time, they don't know. It just comes, and then they go to the emergency room or see their primary doctor and find out that they have AFib. And then you just kind of go from there. If they need blood thinners, high blood pressure medications and different things that they may need to help them to make things, because this could be a very deadly situation. So you got to make sure that you help the patient to manage this well.